Hello friends and welcome to my channel. I'm Dr. Motahare and today we'll talk about endometriosis. What is it? What are the symptoms? How we can make a diagnosis? And what are the treatment options? So let's get started. Endometriosis is a chronic gynecological condition where tissue similar to endometrium, which is the internal layer of uterus, grows outside the uterus. For example, in fallopian tubes, ovaries, pelvic area, peritoneum, or other areas in rare cases. Just like the lining of uterus, this tissue responds to hormone changes during the menstrual cycle, leading to similar events: inflammation, pain, and sometimes scar formation. Endometriosis affects about 1 in 10 women in reproductive age worldwide. Very high prevalence. It's most commonly diagnosed between 25 to 40 years old, but symptoms may begin from the adolescence age. This condition is more prevalent in women who have infertility or chronic pelvic pain. Unfortunately, diagnosis can be delayed for years because symptoms are often mistaken for normal menstrual cramp. The exact cause of endometriosis is still unknown, but several possible theories are present. Like what? Like retrograde menstruation. It means that menstrual blood flows backward into the pelvic cavity, carrying endometrial cells that implant there and grow. At the same time, immune system dysfunction may play a role because the body fails to clear these cells from that misplaced area. Hormonal influences plays a role too, like what estrogen promotes the survival and growth of endometrial-like cells, and also genetic predisposition. Family history increases the risk, especially most of the patient has a positive family history. There is some kind of endometriosis in another women in that family that make us think about the possibility of some genes that are involved in this process. It seems that a combination of all of these things are um, responsible for this disease, but the exact cause is not clear yet. Symptoms vary widely, but the most common symptom is chronic pelvic pain. The other probable symptoms are painful periods, dysmenorrhea that interfere with daily life, painful intercourse, dyspareunia, infertility due to repeated inflammation and scar formation that affects the reproductive organs, heavy menstrual bleedings or irregular cycles, bowel or urinary symptoms during menstruation, such as pain or blood in the stool or urine. Interestingly, the severity of these symptoms do not correlate always with the severity of the problem. It means that even a small, mild disease can cause severe pain and vice versa. Diagnosing of endometriosis can be challenging because its symptoms often mimics other things like a pelvic inflammatory disease or irritable bowel syndrome. First, we start with a complete history, asking about menstrual pattern, pelvic pain, pain in the intercourse, fertility issues, or any family history of endometriosis. Second, we will do a physical exam, a gynecology physical exam, looking for any tenderness, pelvic masses, or nodules in the pelvic ligaments. However, many women with endometriosis have a normal exam despite their active disease. Third, imaging studies like transvaginal ultrasound can help detect ovarian endometrioma, but they cannot rule out the disease in the elsewhere. Here we can use MRI to find out the deeply infiltrating lesions. Fourth, the gold standard for diagnosis is laparoscopy, a minimally invasive surgery that puts a small camera in the abdomen looking for any suspected area. And finally, after that, biopsy. If during the laparoscopy they found anything suspected for being endometriosis, they take a biopsy and send it to the lab, and the pathologist under the microscope will confirm the diagnosis of endometriosis. Often accurate diagnosis require a combination of all of them, and maybe it takes years to just come to diagnosis. It's a hard disease to be diagnosed because the symptoms are not specific, mimicking many other diseases, and also there is no single test to be used to detect this problem. Treatment depends on the severity of the symptoms, the location of the lesion, and also whether the patient wishes to become pregnant or not. For pain management, we are usually prescribe NSAIDs like ibuprofen to reduce inflammation and discomfort. Hormonal therapy sometimes is needed, like oral contraceptives, progestins, or GnRH agonists to suppress menstrual cycles and slow tissue growth. Surgical management, laparoscopic removal or disruption of the lesion, sometimes more extensive than these things may be needed. And also we have some fertility options too, like any other infertility problems. The best approach is a combination of medical and surgical treatments. Endometriosis is a chronic condition without treatment. It can progress. Recurrence is common, especially if the surgery does not remove all the lesions or the hormonal suppression is stopped. But it's manageable. Early diagnosis and effective management can significantly improve the quality of life, fertility outcomes, and long-term complications. And good news is that symptoms often improve after menopause due to drop in the estrogen level. Thank you so much for watching. I hope this video helped you better understand endometriosis. If you found this helpful, please like, share, and subscribe for more clear, reliable medical content. Stay healthy and see you in the next video.